Hello, everyone. We are going to get started in about 60 seconds. We're just waiting for some more folks to join us. Hello, everyone. It is currently 12:02 p.m. Eastern Time Zone. We are going to get started with our today's webinar. So thank you all for joining us today for the webinar Help Us Remain, which is about understanding and supporting 2S LGBTQI experiences with dementia. And this webinar today is co-presented by Egale Canada and the Alzheimer Society of Ontario. Before we begin today's presentation, I'd like to acknowledge that I am currently presenting from my home in what is colonially known as Ottawa, Ontario. And Ottawa is built on the unceded, unsurrendered territory of the Algonquin and Anishinaabe Nation. And I also want to recognize that as we are gathered virtually today, our panelists and our attendees are joining from the lands and waterways of many different Indigenous peoples, including First Nations, Inuit, and Métis communities. And as we go through today's presentation, I strongly encourage everyone to reflect on how you can take today's learnings about dementia and apply it to your journeys of truth and reconciliation with all who call Turtle Island home, including Two-Spirit, gender diverse, indigiqueer, and LGBTQI Indigenous peoples. So my name is AJ Adams. My pronouns are he, him, and I'm the manager of communications at an organization called Egale Canada. And I'll talk a little bit about Egale on the next slide. So why am I speaking to you all today? Well, before joining Egale, where we do a range of work related to dementia and older adults, I've spent much of my career working in the dementia sector, the senior sector, and the broader healthcare field. And that includes working 3 years for a program called the Ontario Centres for Learning, Research and Innovation Long-Term Care, where much of our work focused on that intersection of dementia, long-term care, and equity-seeking communities. As mentioned, I work for an organization called Egale Canada, and we are the country's leading organization for 2S LGBTQI people and issues. And we have a mission to create both societies and systems that reflect a universal truth. And that universal truth is that all people are equal and none is other. Oops. And we achieve this mission through work that falls under 4 key pillars. That includes our research, our education, our awareness, and by advocating for human rights and equality, not just here in Canada, but also around the world. And Egale's dementia-related work falls into all 4 of these key pillars. So today we're going to be exploring Egale's dementia-related research, our dementia-related education, awareness, and advocacy throughout the presentation. So over the next hour or so, we're going to be covering 4 key pieces. First, we're going to look at the experiences of 2S LGBTQI people living with dementia. Then I'll walk you through Egale's award-winning campaign, Help Us Remain. We'll then explore how we can build a more inclusive future for 2S LGBTQI people living with dementia through resources and research. And finally, I'll pass things over to my colleague at the Alzheimer Society of Ontario to share more about ASO's programs and services. So let's get started. So we're all here today to talk about dementia, but let's first clarify what we actually mean when we say this word. The first thing to understand is that dementia isn't one specific disease. Instead, it's an umbrella term to describe a set of symptoms caused by disorders that affect our brain. And a lot of us have probably heard the terms Alzheimer's and dementia used interchangeably. For example, you might be thinking that today's webinar is on dementia, but the co-presenter is the Alzheimer Society. Well, the reason why this is that Alzheimer's is just one type of dementia. So dementia is a broad term, and Alzheimer's is just one of the versions, or one of the types rather. There's also Creutzfeldt-Jakob disease as a type of dementia. There's dementia with Lewy bodies. There's frontotemporal dementia. There's mixed dementia and vascular dementia. And again, all of these are disorders that affect brain function under this larger term of dementia. So why Alzheimer's and dementia often gets used interchangeably is that Alzheimer's is the most common form of dementia, which is why we often see, again, those words used interchangeably, as the organization is Alzheimer Society. And for those who are curious, vascular dementia is the second most common, which is caused by conditions such as strokes that disrupt blood flow to the brain that leads to brain damage and cognitive decline. So when we think about the symptoms of dementia, I think we can all agree we most often go straight to memory loss, and particularly short-term memory loss. And while memory loss is a common symptom of dementia, it's important to understand that memory loss is just one aspect of the condition. Dementia can also affect things such as one's thinking, their problem-solving skills, their language abilities as well. And whether it's thinking, problem-solving, language, or all three, these changes are typically severe enough to interfere with the person's ability to carry out everyday tasks. And in addition to these cognitive symptoms, dementia can also lead to changes in things such as mood changes or behavior changes. So again, dementia is more than just memory. It's about how the brain is functioning as a whole. And dementia is usually a progressive condition, and that means it gets worse over time, or the symptoms that we just talked about become more present over time. So for example, a person might start off with mild short-term memory loss, but as the condition progresses, they may experience changes in their behavior. They may start having difficulty with problem solving. They might start experiencing long-term memory loss and much more. And finally, it's important to recognize that dementia is not a normal part of aging. Well, occasional forgetfulness or mild memory lapses can be a natural part of aging, and we call this age-associated memory impairment. Dementia is different from natural memory loss that comes with aging, because again, dementia is about an underlying disease process that affects our brain function, not natural parts of aging. So some of you may be thinking, okay, so we know what dementia is, but what actually causes dementia? Well, the truth is we don't fully understand what causes most types of dementia. Well, we do know that certain conditions such as neurodegenerative diseases, vascular diseases, head injuries can increase the risk of dementia. The exact causes of dementia often remains unknown. That said, there are several well-known risk factors that are commonly associated with dementia, even if they don't directly cause it on their own. So this can include things such as high blood pressure, smoking, stress, depression, mental trauma, social isolation, traumatic brain injuries, and many other factors. And we're going to talk more about these factors, and specifically, we're going to dive more into the social and psychological ones a bit later in this presentation. So when we look at the trends of dementia diagnoses in Canada, the numbers are actually quite staggering. So by 2030, which is about just 4.5 years from now, it's estimated that over 1 million people in Canada will be living with dementia. And over the next 30 years, that number is expected to grow by 187%. So this number is deeply concerning when we consider the impact that dementia has on our healthcare system, as it already costs our country more than $10 billion a year. And that number is only going to rise as Canada's population ages and dementia rates increase as well. So switching gears just for a moment, let's talk about Canada's 2SLGBTQI population, but specifically, let's talk about those who are aging and reaching the age of 65 and older. So roughly about 7% of queer and trans people in this country are now entering or already have entered the stage of life, so 65 plus. And this group represents the first generation of Canadians to grow old being out and proud. Although in past generations, we have seen individuals come out in early in life and remain out for their entire lives. This is the first generation we're seeing where there are more people out and proud than not. And what's extremely important when we talk about this generation of folks is to acknowledge the historical and the transformative eras that they've lived through. So when these folks were in their teens, when they were in their early adulthood, they were living through some of the most significant moments in Canada when it comes to queer and trans history. So this was well before same-sex marriage was legalized, which is 20 years ago this weekend. These are folks who, again, in their teens, in their early adulthood, they were living through things such as the decriminalization of homosexuality. They were living through bathhouse rates. They were living through the HIV and AIDS crisis, societal discrimination at a level that modern day we can't fully comprehend because it was so rampant back then. So these are folks who lived through momentous moments in queer and trans history. And as we consider the older 2S LGBTQI population, it's important to note that studies have found higher rates of cognitive impairment among these adults compared to their heterosexual and cisgender peers. So you're probably wondering why? Why are they experiencing higher rates? Well, as we discussed earlier, one of the risk factors for dementia is stress and trauma. So when we look at an aging queer and trans population, many have faced discrimination, many have faced hate, many have faced stigma throughout their lives. So again, going back a couple slides to this generation of folks who lived through the HIV and AIDS crisis, decriminalization of homosexuality, and much more, they've lived through a lot of stuff, in very traumatic and stressful moments throughout their lives. So this puts them at risk with experiencing what's called chronic minority stress. So this is stress that members of marginalized minority groups face over a long term simply because of their identities. So in other words, because someone's identity is 2S LGBTQI, they may have experienced ongoing lifelong stress related to their identity as a 2S LGBTQI person. So this chronic minority stress that they experience contributes to various health disparities. So chronic minority stress has been linked to higher rates of cardiovascular disease and depression. And then those conditions in turn can increase risk for premature cognitive decline and dementia. So if we think of everything I just said there in kind of a metaphor, we can think of it almost like a domino effect. So a person who is 2S LGBTQI, and maybe their experiences have been further complicated due to intersectional factors like their gender, their race, their socioeconomic status, they have faced inequities that have increased their chances of having chronic minority stress. And then that stress then raises their risk for things like cardiovascular disease, depression, and more. And then those conditions then put them at a higher risk of things like increased risk for premature cognitive decline and dementia. So again, it's a domino effect when we're looking at the experiences of 2S LGBTQI people when it comes to dementia. Let's now look at some of the challenges and barriers that 2S LGBTQI people often face once they receive a dementia diagnosis. So particularly, we're going to look at experiences that happen within healthcare institutions and social service settings. So one common issue we hear about is refusal of care. So for example, a private personal support worker or PSW who's coming into a person's home might refuse to work with a gay client. We also frequently see misgendering, especially when someone hasn't been legally able to change their name or their gender. And this often happens in institutional settings, such as long-term care, where paperwork defaults to things like legal names and pronouns, leading to dead naming, leading to misgendering. Another challenge is the lack of gender affirmation. For instance, someone transitioning later in life might face resistance from long-term care staff who believe they're too old for things like hormone therapy, or they doubt a person's ability to consent to transition because they have a dementia diagnosis, regardless of where they are with their cognitive impairment journey. We also see recognition of significant others as a major barrier with dementia care. So same-sex partners are often mistaken for roommates. They're mistaken for friends rather than our spouses or partners. And this can have a deep personal, emotional impact on our well-being, but it also has an impact on our rights as human beings. So these are just a few examples of the barriers that 2S LGBTQI people face when it comes to dementia care. But I also want to emphasize that 2S LGBTQI people experience lower income rates on average. So this puts the high cost of dementia care, the high cost of long-term care, assisted living, and more, often financially out of reach for queer and trans folks. So we're going to take a deeper dive into this issue of recognizing significant others in care settings. So when it comes to same-sex partners, as mentioned earlier, they are often mistaken for siblings. They're mistaken for friends rather than our partners and our spouses. And this can lead to a person living with dementia or their caregiver experiencing things like queerphobia, homophobia, and biphobia. For those who have a gender diverse partner, misgendering and transphobia are also common challenges that we see. And a major issue arises around recognition of what's called chosen family. So sometimes called a found family, a chosen family refers to people in a queer or trans person's life who are intentionally regarded as family. So not necessarily by blood or marriage, but there's someone who's trusted, relied upon, emotionally close, how we would like to describe family members, but again, without that blood or marriage connection. And the challenge with chosen family when it comes to dementia care often comes down to legal recognition and specifically within the role of what's called a power of attorney. So for those who don't know, a power of attorney is a legal document. Sometimes power of attorney is applied or as like a noun for the individual. But a power of attorney is a legal document that designates who can make decisions about a person's personal care if they become unable to do that themselves. So, for example, if I were diagnosed with dementia and reached a stage in my condition where I'm unable to make healthcare decisions about for myself, I might want a chosen family member to have that authority to make decisions on my behalf. However, if I don't have that chosen family member legally designated as my power of attorney, they may not be able to make those decisions on my behalf because there's no legal documentation stating that they have that authority. So where this problem comes, or where this problem is, though, is that unfortunately, in the absence of a legal appointed power of attorney, healthcare providers often default to seeking direction from spouses, parents, children, any blood relatives, regardless of whether or not they have a close relationship with that person. So what that actually means is for queer and trans people who are estranged from their biological families, if a power of attorney hasn't been established for a chosen family member, these estranged relatives may be contacted about some of the most important care decisions in that person's life. So making sure that queer and trans folks know about power of attorneys is a super important piece of better dementia care. And just to wrap up this section, I want to leave you with a powerful quote from one of our participants in our dementia-related research. So the participant says, I don't know that there's enough education on what it means to be queer and to have dementia. We as a population are people. We're just people. We should be treated as people and loved as people. So after reviewing everything we just discussed, it's clear that the Canadian healthcare system is not adequately equipped to meet the needs of 2S LGBTQI people living with dementia. So this is exactly where Egale's award-winning campaign, Help Us Remain, plays a crucial role. So launched in January of 2024, the Help Us Remain campaign is a national bilingual campaign that highlights the heightened risk of cognitive decline in queer and trans communities. And it aims to bring the much needed attention to the often overlooked challenges of 2S LGBTQI people living with dementia, which we just talked about. And by focusing on these issues, the campaign strives to create a more inclusive and supportive healthcare system, not just for 2S LGBTQI people, but for everyone involved. And just a huge shout out to the Public Health Agency of Canada for funding the Help Us Remain campaign. So now we're going to watch the main part of the Help Us Remain campaign, which is our PSA video. It's about 3 minutes long. And please note that this video contains some emotional themes. So consider what I'm saying here right now as a trigger warning for anyone who may find this content difficult.
More and more, I find myself lost in the memories of a life I've led.
Son, time to go.
Now you are going to be administering the dose yourself by injecting right about here.
Who's that on the phone, hon?
I don't know. It's okay.
Hello?
Time slips through my fingers like sand.
Mr. Lai. Mr. Lai, the lesson is on the board.
And with it, the things that once defined me.
We're just worried about you.
The moments that made me who I am start to drift away.
You look beautiful.
And while my mind might fade, there is a hope within me that I shall remain.
I feel like a woman inside this shell of a man.
As you're aware, there's currently no working cure for dementia. And your friend's illness is progressing.
My wife. She's my wife, doctor.
We'll get you to fill out this form, and when you're done, you can bring it to the desk.
Thank you.
These fragments of a life seem far away, as if they belong to someone else.
Do you want to go to the back?
Actually, okay.
But the person I've always been, resilient, kind, loving, is a thread connecting it all.
That's why you won't let me medically transition.
What about what I need?
It shouldn't have to be this hard.
Let's get you home now, love. Okay?
And however frayed that thread might be, it's there.
How are you doing today?
Where am I?
This is the third time you've forgotten to give her dosage. It's unacceptable.
Even though the world around me may blur
I missed you.
and distort and shrink itself,
It's lonely at home without you.
Your friend's illness is progressing.
I hold on.
Okay. So I'll let folks have a second to collect themselves. I've watched that video probably about over 100 times, so it gets me every time. But as you saw, that was a very powerful, fictional but powerful story of a trans woman living with dementia, as well as a bit of a perspective from her caregiver being her partner. So storytelling plays a huge role in advancing work, particularly when we're advocating for changing dementia care. So a secondary focus of the Help Us Remain campaign is sharing real life stories from 2SLGBTQI people impacted by dementia, both those living with dementia themselves as well as their caregivers. So as part of the campaign, you can listen to 10 stories that are collected in an audiobook that highlights the importance of telling stories about dementia, but also preserving queer memories as well. As we talked about dementia, one of the changes that happen is both short-term and long-term memory loss. So preserving queer memories is a huge piece of this audiobook. And the audiobook also features a forward and introduction by queer icon and Canadian musician and songwriter Jan Arden, who has her own personal connection to dementia, having lost both her parents to dementia a couple years ago. So I encourage folks to listen to the audiobook. It's quite powerful. Oops, go back for a sec. And yeah, and then as I mentioned, the campaign, we launched in January of 2024. So when we launched the campaign, again, it was a national bilingual initiative. So we had a wide range of efforts from national social media ads. We had out-of-home advertising, which includes things like bus shelters, billboards. We had a launch event called the Gallery of Memories, the 519 in downtown Toronto, and much, much more. And just to toot our own horn here, the Help Us Remain campaign, both the video and the audiobook, has won over 20 national and international awards. So not just Egale, but our agency partners at Cosette and Citizen Relations have won to over 20 awards. And one I just want to kind of tap ourselves in the back for is the Cannes Lions Award. So if anyone's ever heard of the Cannes International Film Festival, Cannes Lions is the sibling festival specific to advertising. So it's a huge deal that we won some awards for this campaign. So now let's shift our focus for how we can create more inclusive and support a more inclusive and supportive future for 2S LGBTQI people with dementia and their caregivers. Or in other words, how can we help us remain? And more specifically, let's explore the question of what needs to change. How do we combat cis hetero dementia care in Canada? Well, to start, I'm going to highlight this research report. So this is a joint report by Egale Canada and the National Institute on Aging called Coming Out and Coming into Living with Dementia. So the report explores how we can better understand the experiences and perspectives of queer and trans people living with dementia, as well as their primary unpaid caregivers. And it has served as the foundation for Egale's dementia-related resource, our dementia-related advocacy efforts, the Help Us Remain campaign. So I strongly encourage folks to check out the report. But let's review some of the key recommendations or the key calls to actions from the report that address that earlier question of what needs to change. So the first call to action is to build 2S LGBTQI inclusive dementia-related services and community spaces. So this means integrating discussions about dementia into existing care programs and social groups, as well as creating more opportunities for queer and trans people living with dementia themselves to come together to support one another, build community. The second call to action is to increase recognition and support for primary unpaid caregivers of 2S LGBTQI people living with dementia. So according to the Health Council of Canada, unpaid caregivers, so this is often family members, chosen family members, friends, they provide up to 75% of the care of older adults living at home. And this care is estimated to be worth nearly $25 billion. And this is a 2012 figure, so advanced 13 years, we know that number is going to be much, much higher. As we talked about earlier, the number of aging people in Canada is increasing, the number of people with dementia is increasing as well. So our call to action here is to better recognize diversely situated unpaid caregivers in things like workplace policies, in government care programs, leave provisions. And we also need to create dedicated support spaces and groups specifically for caregivers of 2S LGBTQI people living with dementia. And finally, the third call to action here is to enhance supports for 2S LGBTQI communities and their carers through both structural and system level changes. So what this means is reducing barriers to accessing dementia-related care. And this is extremely important when we talk about rural and remote communities and small towns, as folks often have to travel to the city, or in some cases, they're not able to access it at all as they're so remote. This also includes integrating 2S LGBTQI histories, rights, lived experiences into core training and education for both healthcare and social service professionals across all fields that interact with folks living with dementia. So whether it's nursing, PSW, physicians, making sure that queer and trans histories, rights, and stories are in those college and university programs is extremely important. So what resources are available to better support queer and trans folks living with dementia as well as their caregivers? Before I pass it off to the Alzheimer Society of Ontario, I'm going to go through some of Egale Canada's resources. So the first resource I want to highlight is called Acting in Allyship with 2S LGBTQI People Living with Dementia. So this is a document designed for both healthcare and social service professionals, and it builds on that research report that I talked about to outline 5 guiding principles aimed at better supporting 2S LGBTQI people living with dementia, as well as their primary unpaid caregivers. Our next resource is called How to Be an Ally to 2S LGBTQI people living with dementia. So this is a resource for anyone who may be interacting with a queer or trans person living with dementia, whether a volunteer, a family member, in a professional role, and it outlines 10 guiding principles to help you be a supportive and effective ally to these folks. For people living with dementia, sharing important information with healthcare providers, sharing important info with social service providers, it can be overwhelming and daunting. There's a lot of things you want to share, and it can be a very emotional kind of initial meeting with folks. So we've created a form called Nice to Meet You, which 2S LGBTQI people living with dementia or their caregivers can fill out. And in the form, it provides key information to support better interactions with healthcare and social service providers. For those of you who like to learn, we offer 2 free e-modules, each taking roughly 45 to 60 minutes to complete. And both of them are focused on how to better support 2S LGBTQI people living with dementia. One of our modules is specifically designed for unpaid caregivers for folks living with dementia. So if anyone here is taking care of someone on a personal level living with dementia, this is a great course for you. And for folks who are on this webinar, who are healthcare, social service professionals who want to better understand how to support their patients and clients who are 2S LGBTQI living with dementia, there's a free e-course for you as well. And finally, from Egale, an excellent resource I encourage everyone to check out is the National Research Center on 2S LGBTQI Aging. And this is an online hub or a website that was created in partnership between Egale Canada and the National Institute on Aging. And this hub acts as a central source for information, for research, for resources focused on everything to do with 2S LGBTQI older adults. So it's not just dementia related work, but all aspects of queer and trans aging. So you can go to 2slgbtqi-aging.ca to check out that site. I'm now going to pass things over to my colleague Ngazi from the Alzheimer Society of Ontario, and she's going to share a bit more about ASO and some of their key programs.
Thanks so much, AJ. Thank you, everyone. Welcome to be here. My name is Ngazi Iranya. My pronouns are she, her. I am the Director of Health Equity and Access for the Alzheimer Society of Ontario. What that essentially means is that I support the 26 local societies around the province with their health equity initiatives. I'm going to get into that in a quick second. Just wanted to say this is a wonderful conversation and topic, one that is so needed as we are seeing the increasing need across the province, and more awareness, more supports, and more resources definitely needs to be developed and generated. Can I have the next slide, please? So just to give a little bit of background about who we are as an organization and sort of what we do, the Alzheimer Society of Ontario is part of a larger national, we're a body of other provincial and local societies. So what that means is we have the Alzheimer Society of Canada as the national head of the federation, and then we have provincial societies, so BC, Alberta, Saskatchewan, and so on. Within Ontario, we have 26 local societies, so the Alzheimer Society of Toronto, Peel, of Windsor, Chatham, etc., to be able to provide enough spread for all the people living in Ontario. We offer programs and services to help people living with dementia. We also support care partners and healthcare professionals. We have resources and education modules, which I'll get into in a second. So what we actually do is we connect individuals and families to support services. And usually these support services are located within their geographical area. So again, one of the 26 societies around the province. So if someone calls from, I don't know, Timmins, for example, and says they need services, we would then connect them to the Alzheimer Society of Timmins. Again, we provide education and resources, and these are for people affected by dementia and for the general public, for those who want information. We do advocacy and we also fund research. I'll get into each of those one by one. Next slide, please. So this is just sort of a schematic. If you can see here, it's kind of lightly drawn in the province of Ontario, and these are where all of the local societies are situated. And you'll see that they're located in more of the bigger cities or more popular cities, as it were. And then the north, you have, again, more of the more populated cities. So we try to cover as much geographical ground as possible and where individuals would sort of congregate more to provide services. When we talk about the work that we do, I want to talk about advocacy for a little bit. We advocate at provincial levels of government for better dementia care policies and stronger healthcare systems. One of the action items that AJ talked about was ensuring that 2SLGBTQIA conditions, experiences, and needs are instituted in training and instituted at all levels of the dementia care pathway. One of the ways to do that is through advocacy, through your local government, to say, you know, we demand and we want more representation, more support, more research, et cetera, more research dollars to understand what's happening within our community. And that's what we do in part at the Alzheimer Society of Ontario. We provide dementia education and training for frontline staff at businesses and public services, and I'm going to talk about what that is and why it's important. And we also support dementia research on treatments, better dementia care, and finding a cure. The better dementia care is where this topic and others would sort of fall under. How do we provide better dementia care, also inclusive dementia care, which includes underrepresented communities and serviced groups. Next slide, please. And so one of the programs that we offer is ALS Educate. So ALS Educate is a unique online education resource. It offers practical and in-depth dementia education, training, e-modules, and more. It's a user-friendly platform. It's very accessible in terms of language, time. All you need is access to a computer of some sort and a Wi-Fi connection. It's geared towards people living with dementia, a lot of care partners, healthcare professionals, and the general public, and policymakers as well. Policymakers do come to our page to sort of see all the news and the goings-ons around dementia to help inform what they want to do. It is free, so all you have to do is register an account, and then you'll have access to all of the material as you need. Next slide, please. Dementia Dialogues is probably one of my favorite programs that we offer. Dementia Dialogues is a monthly podcast. It features people living with dementia, care partners, healthcare workers, researchers, and policymakers discussing all aspects of dementia. So conversation topics can be anything from wills and estates to the latest disease-modifying therapies and how they can support people living with dementia and care partners. So it's any and all things under the sun related to dementia that we put out for general consumption for the public. And we do get on a panel of experts, people with lived experience. So again, also accessible to the public. So you don't have to have a degree to understand what's happening. It's very accessible and easy to engage with. It's available in English and other translated languages, and again, also is free to access content. I've watched this before I started the Alzheimer Society, and I did learn a lot about dementia and how to navigate the journey. Next slide, please. Dementia-friendly communities. So Dementia-friendly communities is actually part of a larger project called the Dementia-friendly Canada project. And this project was actually started by the Alzheimer Society of Canada, again, the national body of the Federation. And the goal is to train the Canadian workforce to how better support people living with dementia when they access public services. So think like recreational institutions, libraries, restaurants, banks, retail areas, public transportation sectors. And it's super important because people with dementia are also in the community. We often think people with dementia are living in long-term care and they're sort of tucked away from everybody. But in the early to mid stage and even the beginning of the late stage of dementia, people are still very much part of the community, contributing to the community. So they go to the bank and they take the bus and they go shopping and they go to the library. And sometimes, unfortunately, they can get disoriented. They can wander, lose their footing. And it's really important that our general public understands, knows what the signs are, knows what the symptoms are. So if they see somebody, they can identify and say, let me support them. I was on a subway many years ago and I saw a woman in the subway. She seemed very confused and disoriented. And the TTC folks were not adept at being able to support her. It was very busy at that time. I think they had a train shut down. So I took her upstairs and I, tried to communicate with her. She didn't really speak English. What she was needing. She pointed at her phone, daughter. So I called the daughter and got her into a cab and got her home. But being able to train TTC employees and other folks on what to look for can really help to keep folks living with dementia safe, keep them secure, and help them get to their destination or access whatever services they need in a safe and dignified manner. Ontario is a partner on the project, so we offer trainings to those industries across the province, those who contact us and say, hey, we'd like to train our staff on dementia, aspects of dementia, signs and symptoms, and how to support people when they come in to use our services. So that's something that I find really, really important and really, really useful as well. Next slide, please. So You First. Now there's You First and You First Advance, but You First Advance is sort of under the helm of You First. And it's workshops to help train unregulated healthcare providers to provide support to people living with dementia. This is good for PSWs and home care workers. PSWs and home care workers, they're not necessarily regulated. There's no regulatory body. There's a lot of colleges, but no regulatory body to oversee standards and adherence to standards, et cetera. And so because of that, when they're in their PSW training, they are given a module on dementia for sure, but it's not perhaps as in depth as it needs to be. And this is important because PSWs tend to work with families privately, or they work in long-term care homes. And in long-term care / retirement homes, or long-term care for the most part, a lot of people, majority of them, have dementia or have some form of cognitive decline. And having your workforce be really well trained on what to look for, how to communicate with people living with dementia and their loved ones and their care partners as well, having to monitor behavioral tendencies, how to even physically handle folks is really, really important to ensure that people living with dementia, wherever they live, have access to safe and dignified and really standardized care. So we do offer this to people. This does come at a cost. People can register as individuals, as a group. So we would go out to long-term, we won't go out, but people from long-term care homes can contact us and say, hey, we want to train, 30 of our staff to better support people with dementia, and then we would provide this training to them. So it's really useful. It's just an added kind of like a top up to what the original curriculum is, but to ensure that folks are able to get that dementia training as they need. Next slide, please. Finding your way. So this is super important. Again, that I talked about with the dementia-friendly communities. Sometimes folks with dementia can unfortunately get lost, get disoriented, and wander. And it can be very, very stressful and very, very terrifying for people living with dementia and for their care partners and community members. So finding your way helps those affected with dementia to recognize the signs and the risks of people going missing and being prepared, what to do, who to call, what kind of steps you can take to ensure that the person is found, returned home safely, and other measures you can put in to prevent that from happening again. Each province or each society across the province has some sort of finding your way kind of program where they would work with local authorities, so local police or fire or whoever it is in their area. And sometimes what folks do, what the police would do is they would give you like a bracelet or some sort of foot bracelet or ankle bracelet or something, a key you put in your pocket or in your wallet, so that if a person should get disoriented and wander off, the police would then be alerted, or you would alert them, and then they would go out with sometimes wire antennas to sort of like a beacon to track where the person has gone and where they could possibly be. That has happened with me and my family. My father did wander and he was found by the police down by the church. He thought he was going to church one day, so he took a bus and went all the way down there. It was very important for us to get that underway so that should it happen again, we know what to do. And it's really, really important, especially as folks, some folks might be taking care of senior parents and having young children or working, and sometimes they can't be everywhere at once and they're very tired and things do happen. So this is just an added way to ensure safety and security for persons living with dementia and their care partners. The program offers free educational courses and access to other resources as well, and again, offered at most, if not all societies by now. Next slide, please. Support by phone. So this is a service that we don't necessarily offer, but we remind folks that if they need any sort of non-emergency after-hours support, they can call the Telehealth Ontario line. Telehealth Ontario, depending on the severity of the issue, would usually refer folks to local emergency room or clinic to get some services. But we remind people again that, if it's late at night and something has happened, they can call telehealth if they need, if it's not an emergency. Next slide, please. One program that I really, really love, in addition to the day programs that we offer, every society has a day program that people can go living with dementia. I'll talk about that in a second. But one of the programs we specifically had is called Minds in Motion. And Minds in Motion is a community-based social program for people with early to mid-stage dementia, which means that they can still be ambulated by themselves, so they can walk and go to the bathroom, etc. And their care partners as well can join to encourage physical activity and mental stimulation. One of the risk factors for dementia, as AJ has pointed out, is diet, lack of exercise. So this is a way to get people's mind and body engaged, which can also help to, I don't want to say slow down the progression of dementia, but certainly help with managing and living with the disease well. And so they offer these services, Minds in Motion, for folks to come out for a couple of hours to just sort of do some light exercises, just to sort of keep the body engaged. Next, and this is also, there might be a little bit of a cost to that. Next slide, please. Support groups. I cannot speak highly enough about support groups and the benefit of joining support groups. Every society offers support groups and individual counseling for people living with dementia and for their care partners. You can contact your local society for in-person or online options. Since COVID, there's been a lot of more online options, and also for safety for people who might be older and might have a weaker immune system. Support groups and individual counseling are vitally important, if not for getting tips and support on how to handle certain situations. It's just also really great for the validation that what you're going through, you're not alone in what you're going through. There are other folks going through it as well. And there's comfort in that. There's comfort in knowing that there are people out there who can commiserate with your experience and even provide some support and some help. I know in the city of Toronto, they have support groups specifically for 2SLGBTQIA community members. Not so much in the other parts of the province, but those support groups in Toronto are available online. So anyone from the province can also register and join. So they do offer that accessibility as well. We are working in getting these spread out across the province as well. So that is in the works. Next slide, please. Now, how would one access any of these programs? We do have a program called First Link. Now, First Link is the gateway program. It's a referral program to help newly diagnosed people with dementia and their families get the help they need as soon as possible. So once, and unfortunately, you do have to get a diagnosis, which can be problematic. When we talk about 2SLGBTQIA and the barriers, systemic and societal barriers to being on the dementia journey, an overlay to that is a cultural factor as well for folks who are from different ethnicities and different cultures where dementia is very stigmatized. It can be a little bit of a barrier to go and get that diagnosis and to begin that process and that journey. But getting that diagnosis will put you in contact with the First Link program. From the First Link program, then you get a referral to a First Link coordinator, and they will connect you to your local Alzheimer Society to access all of these services and all of these programs as well, and other community programs. So it really is sort of the beginning step on the journey, but making that step as soon as possible or sooner than later will help ensure that you have access to the right services, the right people, right support groups, counseling, and then you can work in tandem with your healthcare provider to get this sort of more wraparound support for the person living with dementia and for whoever the care partner will be. Because sometimes, you know, taking that first step can sometimes be the hardest step and be the scariest step. But after that, hopefully the journey makes a lot more sense and you have more support. Can I have the next slide, please? So this is the link to the First Link program. I strongly encourage all who think that they are experiencing dementia, who have the diagnosis, or supporting someone living with dementia to make that call to connect with someone to ensure that you get the services and support that is needed. Thank you so much, AJ, for your time and letting me speak about that.
Thank you so much, Ngazi. So to wrap up today's presentation, before we go into questions, I want to remind folks of 3 key actions that we can take to better support 2SLGBTQI people living with dementia and how to help us remain. So the first thing that we can all do is keep learning about the experiences about 2SLGBTQI individuals living with dementia, but also about their care partners' experiences as well. The second thing that we can all do is educate ourselves on how to make dementia care, healthcare, and social services more inclusive, not just for 2SLGBTQI people, but all individuals. And finally, the last thing that we can all do is by taking action, by advocating for more resources, more support for 2SLGBTQI people living with dementia, as well as their unpaid caregivers. And I'm going to pass things over to our wonderful moderator, Dennis, to ask any questions that we might have in the chat. So if folks have questions, feel free to write them in the chat box there.
Hey, everybody. There's just one question so far, but hopefully more coming in as we address it. Folks, if you can just look to the chat pod and send in your questions there, that'd be much appreciated. There's one question. What are the rates of dementia in 2SLGBTQIA+ seniors and elders compared to non-2SLGBTQIA+ seniors? Was there any insights or information either of you could provide on that?
It's a great question. I don't know off the top of my head. I believe there's some stats in some of our research, so we'll make sure that's linked out in the post webinar survey. But something that Ngazi kind of noted is that there is a bit of a cultural barrier when it comes to dementia diagnoses, and particularly when we look at like the intersectional lens of 2SLGBTI people. So not everyone gets a dementia diagnosis for various reasons. So regardless of what numbers we currently have as a country, those numbers likely there's a lot of disparity in them for many different reasons. Folks not being able to access dementia care, folks not knowing about what services are available and things like that. But any data that we have, we'll make sure that we follow up post this webinar.
And for ASO, do these same programs and resources shared, do they exist within other provincial Alzheimer societies? For example, ASA, Alzheimer Society of Alberta?
Yeah, so each society around the country would have access to day programs, support groups, individual counseling, Minds in Motion. I don't know about any other specific programs. I know First Link is available across the country. I don't know if other provinces have what services they have. We operate sort of in a federated model, as it were, that in the sense that BC sort of is BC, Alberta is Alberta, Saskatchewan, Saskatchewan, et cetera, et cetera. But I do believe, if I'm thinking correctly, BC would have some resources for 2SLGBTQIA, and I want to say, Montreal, or maybe, or it's not Montreal, Quebec, Montreal, or maybe Nova Scotia. I want to say, but I can't confirm on that.
Another question came in on how can we support the Help Us Remain campaign or support future efforts for 2S LGBTQIA plus people and their experiences with dementia?
For the Help Us Remain campaign, watch the video, share the video, listen to the audio stories. Again, as I left you folks with 3 kind of calls to action at the end there, understanding experiences, so listening to our 10 audio stories within the audiobook is something that you can do. Share it loudly. On the Help Us Remain webpage, you can find all of the resources that I talked about. So on the screen, you see Galveston/dementia. So yeah, so just continue again to learn about experiences, advocate to folks. So when you're talking to politicians and elected officials, making sure that they're aware of the Help Us Remain campaign, the work of the Alzheimer's societies, and more. So just making sure that you're learning and raising your voice.
And to that, we actually have, there's a question, sorry, there's to that about advocacy. We do have an advocacy college that was launched last year at the Alzheimer Society of Ontario. It's an online college, it's free, you can take it. What it does is it helps you learn how to write and advocate to your MP and your MPP for the things that you need. And I stress this because folks living with dementia are often felt as invisible, like they're older and they're sort of away from society, and people think that maybe they don't have much to contribute, but that is absolutely not the case. And especially for care partners who are doing a lot of the work and sometimes double lifting if there's children at home and older parents. And so using the advocacy college to learn how to engage with your elected officials can really help push these advocacy pieces along to get more representation and more funding dollars.
Yeah, I just quickly searched that and put it in the chat as well, so folks want to access that there. There was also a question, someone's wondering if there's any research on, perhaps this is what you're referring to, the advocacy fatigue. Do people with dementia and their partners lose the capacity to advocate for themselves later in life because of a history of advocacy and associated burnout?
I wouldn't say that. I would say it's more about the having to provide the care. I think it's not so much advocacy burnout as opposed to caregiving burnout. You don't have time, you're exhausted. And to advocate in a way that gets noticed, you need to be strategic about it, right? And that's why the advocacy college would be helpful in being strategic. Like for me, when I advocate for my dad, I'm advocating usually at the individual level with the doctor and the nurses, right? And the long-term care directors. I'm at that person-to-person level. To go higher, you're tired, right? You're working all day, 10, 12 hours, you're coming home to do this, you don't have the energy. And so to be able to do it in a way that you can maximize and optimize your success rate in getting a hold of someone without adding as much more work to yourself, that's when I myself did the college course to figure that out.
And probably just about 2 more questions. Someone's curious to know the rates, based on the data that we have, to know the rates of BIPOC older adults/seniors living with dementia versus white older adults/seniors. Is there data or research on that?
We don't have that yet in Canada. In the States and the UK, we have that. In Canada, they're trying to get demographic data, and we have pockets of it here and there, but across the country as an average, we don't have yet. But what we do find in the States and in the UK is that folks who are Black and Indigenous have higher prevalence rates of dementia than non-Black and white folks. And then within the POC population, South Asians and East Asians also have, Hispanic have higher rates of dementia. And that's from a multitude of factors, not necessarily genetic, but more cultural, environmental, social determinants of health factors.
And last question, do we know if there are any discrepancies between care for 2S LGBTQI people experiencing dementia in long-term care facilities, nursing homes, and home care models?
Sorry, any discrepancies?
Yeah, between the different, I would say, forms of care. So in a long-term care facility, a nursing home, and home care models, do we know if there are any discrepancies between care for 2S LGBTQI people experiencing dementia in those places?
Yeah, so that can be a loaded question. So it depends on what we're talking about. So long-term care, retirement, assisted living, et cetera. It depends if we're talking about a new build or an old build. It depends on the staff working there. It depends if we're talking about private or public or not for profit. So there's a lot of challenges there. There's a lot of great work out there on trying to make long-term care and retirement more inclusive of 2S LGBTQI people. So as I mentioned, I formerly work for the Ontario Centers for Learning, Research and Innovation in Long-Term Care. So they do a lot of great work, not just in queer trans issues, but EDI kind of as a whole, trying to get long-term care more inclusive of dementia care. That being said, different institutions, but also like privately coming into your home care providers can be on different journey paths as well. So some folks are still in the stage of learning how to use pronouns, and others are on that more advanced kind of level of that advocacy piece and support group piece that we're talking about. So yeah, so simple answer is yes, there's disparities, but there's a lot of factors when you kind of go institution to institution.
Well, that was the end of the questions. Other than that, there are so many comments of appreciation and gratitude to the both of you for sharing all your insights and information. So also a thank you from me as well.
Amazing. Thank you so much, Dennis. So on behalf of Egale, myself, Alzheimer Society of Ontario, Egale Canada, thank you all so much for attending today's webinar. We would love to hear your feedback on today's session. There's a QR code on your screen. Feel free to scan it, fill out the survey. I believe there will be an email sent to the folks as well. So thank you. Keep up the great work of learning about intersectional experiences with dementia, and have a wonderful day, folks.
Thanks, everyone. Bye-bye.